AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we're teaching you how to live a longer and healthier life. I'm Lorena Anderson, and I'm your host for this evening's show. You can find us here every Tuesday between 6 and 7, streaming live on 1470 AM and 95.3 FM. We're being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. We bring you doctors every single week so that you have the ability of being informed, educated, and also knowing what state-of-the-art technology is being produced in the world of the medical arena. So I would love to introduce my doctor for this evening. It's Dr. Himmelstein. It is wonderful to have you here. Thank you so very much for being a part of this, for taking time out of your busy schedule and sharing with us not only your practice, but also you have a very, very special story. And I cannot wait to share with our audience about that story. Now, first of all, if you have any questions whatsoever or any information for the doctor, you can call here at the station. It's 888-565-1470. Now, if you miss the show, you can also call All County Healthcare, ask for Maddie. Her telephone number there is 888-717-7170, and she can put you in touch with the doctors as well. Plus, we're streaming live on All County Healthcare fan page on Facebook. The other thing also is that if you've missed any of our shows, you can always go to All County Healthcare, their website, allcountyhealthcare.com, and all the shows are archived there. So just in case you missed tonight, you can always go there and watch us again. So thank you again for coming. Please share some of your story. First of all, what got you into medicine?
I got into medicine. I guess I just grew up being attracted to it, wanting to help people, being there in ways. My father was a physician, and he was probably the old-time Marcus Welby kind of physician, in that I remember as a kid hearing him get up in the middle of the night to make a house call or whatever.
Really? Oh, my goodness. Yeah, that's almost unheard of in this day and age.
Go to the Minute Clinic.
Yes.
But otherwise, I just went about my life growing up with all the struggles and dreams about doing all sorts of things, and it just seemed that medicine was the way that would fulfill me. So I went to medical school and learned to be the doctor. And I remember in medical school and training, it was always like, well, when you get done, what kind of doctor do you want to be? When you get done your general internal medicine training, what kind of specialty do you want to be? And whereas specialties were always in some way attractive, I sort of felt that always felt that, like, first be the general medical doctor, because that's the person who deals with you. Nothing against my colleagues who are specialists, but that's the person who deals with the whole you as a human being.
Yes, the holistic part, right?
People sometimes, my patients sometimes laugh because in this day and age, when you're signing onto the computer, I'm always making eye contact and saying, so tell me, what have you done recently for fun?
I love that. That is very, very interesting, because I don't believe that we've had many doctors saying that at all.
And
What do you do for fun?
so
I
you know,
love
what,
it.
what do you, well, you know, to me that's a great opener
Oh, yeah.
because you can learn a lot about the person, what their mood is, what's happening in their lives, all kinds of stuff. Oh, I haven't been having any fun, doctor.
Uh-oh. There's a red flag for you.
All right, why not? You got to get out and go dancing, you know, or something. But you know, so what have you been doing for fun? Is one of those kind of things. At the end of the visit, when everything, God bless them, they're 80 years old. Everything is relatively in order for their medical problems. You know, it's like, excuse me, Mr. and Mrs. So-and-so, congratulations, you're boring.
So you tell them to go out and have some fun?
I'd say, you're boring. Medically, you're boring. And that's a good thing. It's a compliment.
Oh, I love that.
Yeah, you don't have anything interesting. Because to me, it's like, and this will get the personal part here. In training, one of the sayings, cynical, dark humor sayings you would have would be when you're making your rounds with your different patients is the last thing you want to be is the interesting case.
Ah, yes, you're right.
All right. So when I can look at the patient and say, Mr. and Mrs. Smith or so-and-so, congratulations, you're boring. It's like
that's very good. Yes, absolutely. And that's what you look for, I'm sure.
Yeah. So so where that comes personal is about 7 years ago, being a doctor and therefore being a lousy patient.
You know, you doctors do have a little bit of a reputation.
But I understand nurses may have an edge on us at being bad patients. But anyway, but no, seriously. So being a doctor and not, you know, and everything, being what you consider relatively young and healthy, you know, you're immortal. I was doing some things in my office, and I just off the cuff had my staff draw a routine lab work on me. And the serum creatinine, which is inversely related to how well your kidneys are functioning, was way off the wall. So that was like, whoa. I had some colleagues, David Scott, a nephrologist, kidney specialist, and Benjamin Tripp, a urologist, colleagues of mine, friends of mine, helped me with it. At the time, I didn't have a lot of faith in my health insurance, so I stayed under the radar. But they worked me up. I had 2 small clusters of grapes instead of kidneys.
Oh, my goodness.
Little cysts. Now, it's like that would normally be a problem known as autosomal dominant polycystic kidney disease. And that's a mouthful, but basically that would be a genetic disorder where your kidneys form all these cysts and things because of different kinds of genetic disorder, and they fail. I didn't have any of that in my family history.
Okay.
I didn't have any of the comorbid things that go along with that. Like sometimes if you have a certain disease, you might have other symptoms. None of my family members I knew of had any of these other things. Maybe I was one of the 6% that was blessed with the defect when spontaneously when I was born.
Is it usually genetic? Does it go from generation to generation?
But I didn't have any of that.
Okay.
We figured, okay, we'll treat blood, make sure blood pressure is controlled, all that kind of stuff. 6 months later, in the spring of 2011, my kidney function on my blood test was even worse. Okay, my mind was sort of going into a spiral.
Oh, goodness.
With my help of my friend David Scott, the kidney specialist up at Delray, we found the specialist in Rochester, Minnesota. Mayo Clinic has always been kind of like some kind of surreal, imaginary place in the Emerald City, so to speak. You know, and this guy, this specialist, very great specialist, was there, and my health insurance would actually cover the Mayo Clinic. I was blessed. And I swallowed hard, and I called his office and asked if he was seeing new patients, and they said, yeah. I said, when's the next first available patient? This was June. Office for a new patient. August 11th at 1 o'clock in the afternoon. I said, I'll take it.
Yeah, absolutely.
The long and the short of it is I was diagnosed with something called tuberous sclerosis complex, TSC. Usually that presents in small young children as neurological disorders, severe cognitive impairment and whatnot. When you've
Oh.
dodged that bullet, when you're in your 40s and 50s, it can work as scarring over of kidneys.
Okay.
Here I am. So I was the interesting case.
I would say yes, unfortunately.
Yeah. So that was a one-way trip. By the next year, I had another follow-up with this guy, this specialist at Mayo, and he wanted me to come back to be worked up for the deceased donor kidney transplant list since it's very long. I've been on that. This December will be 5 years.
Oh, my goodness.
About a year and a half ago, with some help of some friends, I started a Facebook page, New Kidney for Stu, STU, with posts regularly that can be liked and shared because there are people who altruistically will donate a kidney. A healthy person doesn't need more than one kidney in life, and there are some walking angels out there that donate to other people. The ones that I've met have this positive energy in them that you couldn't believe. I know you're a wellness person, and as
Yeah, I
as,
am.
as a wellness person, you would appreciate that. It's just such a robust, positive force in them. You can tell. But so anyway, we've had this campaign going, and hopefully, it'll succeed in helping me get a kidney, because then I can continue going about being Stu, Dr. Himmelstein, whatever you want to look at me as,
Yes, yes.
being myself, doing good in the world, doing all those kind of things, ballroom dancing, I don't know. But also because of my congenital defect, it's causing the failure. Unlike other people who have kidney failure and need transplants because of inflammatory diseases or diabetes or hypertension or the like, mine was inherent in that organ, in the cells in that organ, so the new kidney won't suffer the same fate.
Gotcha. So, you know something? We're going to take a break at the moment, and then when we come back, we're going to find out more how we can help you.
Okay.
Stay tuned.
Good.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back to You and Your Doctor. We have a very special guest, Dr. Himmelstein, who's on with us, who happens to be looking for one of those walking angels, as he had put it. Doctor is in need of a kidney, and part of our program tonight is to see if we can help him find it's a donor, one of those walking angels. So thank you again for being on the show and then also sharing your story with us, because we really do appreciate it. And we want to help in any way that we possibly can.
Thank you for letting me have the avenue to do that.
You're very welcome. You're very welcome. So tell us a little bit more about what you've had to go through in these last 4.5, 5 years waiting for a donor.
There is approximately 95,000 people in the United States on the deceased donor kidney list waiting for a kidney. The average wait is about 5 or 6 years, depending on blood type. It can be longer, sometimes it's shorter. Including all other organs, there's 120,000 people, but let's talk about kidneys. Roughly 95.
Wow.
The deceased donor list I've been on, but also a live donor, altruistic donor, and we say altruistic donor because nothing is exchanged except goodwill. They're not purchasing is not the issue. It's the goodwill of someone wanting to do goodwill for their fellow human.
Okay. So that's not a paid
No.
issue at all.
No.
No. Okay.
No. So,
It's one of those angels, as you were talking, walking angels.
Sometimes you get someone coming out on the social media page saying, "Oh, I want to give you my kidney, blah, blah, blah," and you respond back, and they respond back and say, "Oh, but you didn't tell me how much you're going to pay for it." And it's like, no, that's not where we're going. These are people who want to just help another person live their life and do, and there is a ripple effect too, because if a live donor gives me a kidney, I get off the deceased donor list, which makes the next people in line on the deceased donor list that much closer to getting a kidney on the deceased donor list.
Now, do you find that there are a lot of people that sign up for the donor list, the deceased donor list? I know it's usually on the back of your driver's license.
I mean, like the donors and everything.
Right.
I don't know how many people actually, what the numbers are for organ donors on their driver's license, but ever since I've been on this list, I have a whole nother thought about the person zipping by in the little motorcycle without a helmet on when you're driving up 95.
Yeah, and that would be. Yeah, I can understand.
I know that sounds cynical, but
Yeah, no. Sometimes I feel about the same way, and I'm just like, are you serious? Do you know how you're, putting everybody at risk, really?
It's like, I hope you have an organ donor thing on your card.
Yeah, absolutely.
But no, seriously, it would be a great help if I were to be able to get a kidney. I could continue doing what I do, being there for people, whether it's directly practicing medicine and treating you as an individual or helping make sure things are done in healthcare the right way as well. I've always been very active in organized medicine, too. 10, 12 years ago, I was the president of the County Medical Society.
Oh, wow.
5 years ago, I did a stint of a few years as the president of the Florida chapter of the American College of Physicians, which is the internal medicine group. And we had a great deal of effort bringing physicians together, and also doing a lot of lobbying work to make sure that we can possibly improve healthcare on a national level for society in ways that, if, from the inside, we have insight on how to maybe help do things a little better. And I enjoy doing that. And I've backed off on a lot of that stuff because right now I don't really have the energy. When I finish with us here, I'm going to go straight home and set up my peritoneal dialysis machine that I hook up to every night for 8 hours.
Oh, my goodness.
And to, cleanse my body of what the kidneys usually do. And, someday when I have a kidney, I won't be able to do that. I won't have to do that, and I'll have more energy.
You can dedicate your job, your time and your energy
to all this other
healing other people.
Healing other people and doing all this other kind of cool stuff with healthcare.
Absolutely. So at this moment, what I'd like to do is I'd like to give you some of the information that the doctor has given me. First of all, Stu's blood type is 0.
Oh, positive.
O positive. Okay, I got there. O positive. To help him you can contact Mayo Clinic, and this is the website that you can go to. Please get your pencil and paper
Can I
out.
interrupt? Maybe it would just
Sure.
be easier to just give them the phone numbers.
Well, I can do it all.
Okay.
Okay. Sometimes it is just easier.
Okay.
Yeah, something that's a good idea. The telephone number that you can call them at is 866-227-1569. And you can also now contact Cleveland Clinic, Florida, in Weston, Florida, and you can call them by 954-659-6750, option 3. And when you call one of those transplant centers, please specify that you are calling with interest in donating for Stuart Himmelstein. Okay?
Thank you.
You're very welcome. And if you have any information right now while we're on the air, the telephone number here is 888-565-1470. You can give us a call here. If you can't reach us here, you can always call All County Healthcare, ask for Maddie, and that number is 888-717-7170. And she will put you in touch also with Dr. Himmelstein. Wonderful. But I want to talk to you a little bit more about some of the areas of growth that you've stepped into because of what you're dealing with. What are some of the other things that you have grown into or identified or that has come to your insight, such as some of the things that the audience might need to know in order to understand whether or not they're dealing with any kind of kidney issues?
I would say just get a regular checkup from the doctor, even if you perceive yourself as being young and healthy. Mm-hmm. Because medical problems are things that sometimes will quietly present before you have symptoms in earlier stages when they're very treatable. Mm-hmm. Mine would not have been, but still, just for the wellness of humanity, the earlier you catch something, possibly the better the prognosis, the outcome.
What are some of the symptoms that they might need to be aware of?
For the kidneys?
Yes.
Possibly fatigue.
Okay.
Usually early, like with mine, it's pretty vague. I mean, there's until it gets very advanced, there's not a whole lot of symptoms. Mm-hmm. That's why, a routine blood test every so often is beneficial.
Well, your annual checkup, right?
Yeah, annual checkup, maybe if you're young and you want to squeak by every 2 years, but at least do something.
Right. Excellent. So would you say that sometimes you have to be careful of identifying those conditions, the kidney malfunctions, excessive urination?
Not really, no. Well, maybe sometimes there could be, depending on what the problem is. Mm-hmm. There could be anything from too much, too little, whatever.
Okay.
Yeah.
All right. Well, that's important to know. Or a pain in the back. Is that one of the symptoms as well?
Once again, depending on what the primary issue is.
Mm-hmm. Gotcha.
It could be very vague. It's sort of like a vague symptom, like
yeah, because you
nausea,
didn't know, right?
Someone comes in and says, "Oh, doctor, I've been nauseous." Well, the nausea could be 101 different things in the differential until you specify other specifics that help narrow it down.
Gotcha.
So, I think a regular checkup is something, and as someone who's usually considers themselves, I think has a reputation for being an empathetic physician, it's not you with the disease, it's me, and it's like,
That was a real shocker, huh?
Yeah.
Yeah. Yes. What is a typical day like for you? A day and a night for you?
I get up a little extra early, do my rounds in the hospital, do my stuff in the office. My office isn't as busy. I haven't pushed to keep it as busy as it could have been. Mm-hmm. I'm there for my patients. Mm-hmm. When I get home at night, rather than doing the usual things people do in the evening, I set up my machine and I have dinner and I take care of what has to be done and then go to bed early so I can set up. Mm-hmm. And then I get finished really early in the morning, which gives me time to unhook from the machine and go back to sleep in a feigned degree of normalcy. Then up at 6 o'clock in the morning again to start the whole merry-go-round again.
Wow. How did they get a hold of you, doctor? What's your telephone number that they can call you, your office number?
Oh, 561-495-9292.
Okay. Excellent. So just in case, one of those angels are out there and walking around and all of a sudden it hits them.
And also, if any of the people do Facebook, to go to the New Kidney for Stu page and once a week or two like and especially share one of the posts.
Excellent. Excellent. I will be doing that, by the way. Absolutely.
Thank you.
I will like and share your post. Anything else you'd like to share with us, doctor?
Just, I can't wait till I'm thinking, to stay positive, and I look forward someday to having that kidney and then continuing to be the best me I can be.
Excellent. Well, thank you so very much again for being on our show. Totally appreciate it. I'm thrilled that you came on and shared your story. And please, if you're out there and you're walking around and this story touches your heart, please give him a call at 561-495-9292. Give him a call and let him know that you're out there and that you're willing to help, because he's got a major job to do. There's people that are counting on you. They need your energy, and also they need a little bit more of that Marcus Welby.
I don't do house calls, though.
Okay. But you've got the sincerity and also the compassion and the empathy that's so important for patients, and to be able to share that with everyone. So thank you again for coming on. We're going to go to a commercial break. Stay tuned. We have another doctor on for us.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your host for this evening for You and Your Doctor, where we are really busy teaching you how to live a longer and healthier life, and also giving you the best doctors out there so that we can help keep you informed to the state-of-the-art technology that's coming out in the medical field every single moment. So I'm really excited that we have our next doctor, our guest, Dr. Perez, and he is from Puerto Rico. So, our prayers and thoughts go out to our Americans that are in Puerto Rico and the situation that they've been dealing with.
Thank you.
But it is wonderful to have you here. Thanks so much for taking time out and being a part of this evening.
Very happy to be here.
Well, that's wonderful. Tell us your specialty, what you have studied, and what you bring to the table for us tonight.
I've been studying for now almost all my life. I'm 33, and since I've been 16 years old, I've been studying. I'm a neurosurgeon. I practice neurosurgery, and what that means is that I'm part of a medical specialty that's concerned with diagnosing and preventing central nervous system disease or pathology, which means brain tumors, spinal degenerative disease, or vascular issues that concern the brain or the spine.
Wow. And you've been training since you were 16?
Well, yeah. I mean, between college and medical school and my residency, the neurosurgical residency is actually 7 years, which is one of the longest residencies out there. So I feel like I've been...
Are you a child prodigy here?
No. By no means am I a child prodigy, but I feel like I spent most of my life studying, and therefore I feel like I've been a child for most of my life. And now I'm getting a chance to be an adult for the first time.
Well,
it's very exciting.
That's very exciting. What created this passion inside of you to become a doctor, and especially in this particular field?
It's very funny. Growing up, I think I never thought that I would be a doctor. It was never something that I wanted to do. I think I went from wanting to be a dolphin trainer to wanting to be a reality show actor.
I love it.
And I went to college, and I really never knew what I wanted to do. And I met this girl called Yas, and she was very instrumental during my college years because she was like, "What do you like?" And I was like, "Well, I like talking to people, and I like studying human interaction. I'm very intrigued by human interaction and dynamics." And she's like, "Great, well, maybe you want to be a psychiatrist and you don't know about it." And so she's like, "I'm doing these pre-med courses. Maybe you can do them with me. And if you, at the end of it, you want to be a doctor, you want to be a psychiatrist, then you can do it." So I said, well, because of lack of having any better idea, I'll do that. And I did it, and I did very well in my sciences. It was at the University of Michigan. And then after I was done...
A little chilly there, isn't it?
Yes, very much so. That was my first winter.
Was it?
Harsh.
Oh, my goodness.
Yes,
well, I'm from Chicago, so I understand those winters.
The windy cities, yes.
Oh, yeah, you're not
so
kidding.
I finished my college degree, and I went to medical school. And while I was at medical school, I started doing well in my classes, and my professors were like, "So what are you thinking? What do you want to do?" And I was like, "Psychiatry." It's like, "No, you can't do psychiatry. Absolutely not. You cannot do psychiatry. Anyone can do psychiatry," which I disagree with.
Okay.
And then, so I was like, okay. And then that next month, we were switching, and I did neurology. And once I did neurology, it was just very easy for me to grasp. It was nothing. It was something that I didn't have to study. Something I didn't have to think about twice. It just stuck on me.
Oh.
And I was like, well, you know what? I want to be a neurologist. And so there started my passion with neurosciences. And then we never had a neurosurgery rotation. So when they asked me again, they're like, "What do you want to be?" I was like, "Neurologist." No, you can't be a neurologist. If you're gonna be dealing with neurosciences, you have to be a neurosurgeon. And I was like, sounds interesting. Okay. So I did my rotations. I came to United States, and then I did sub-internships at Northwestern, NYU, and Miami.
Okay.
And so once I started doing it, I fell in love with it. Just the fact that I can use my hands to treat a patient and help him was just amazing for me. It's just part of my personality. I'm very proactive, and I like to be doing something.
Yeah, I can tell. You're very high energy, too. That's
yes.
fabulous. So tell us a little bit about the brain tumors that you end up working on. And also what you end up seeing, especially down here. What are some of the common things that you end up working with?
Well, there's different kinds of brain tumors, right? There's brain tumors that are non-cancerous, which we call benign. And then there's tumors that are cancerous, which are not benign, they're malignant. Most of the most common tumors that I see are benign tumors, which are called meningiomas. And these tumors are actually not of the brain itself, but of the covering of the brain. And those are tumors that are most common and the ones that I see the most. Yeah.
That must be a great relief when somebody turns around and says, it's not malignant.
Yes.
And
But it's always a shock for a patient to have a diagnosis of a tumor, whether it's
Right.
benign or not. Just the word tumor encompasses so much anxiety for any patient.
Yeah, fear.
Yes. So
Absolutely.
it's very important to recognize people's anxieties and fears and try to cater also to that part of the medical care.
I can tell that you have a level of empathy. And when you're dealing with patients and being able to share that kind of information in the most kind and tender way.
I do. I think I get it from my mom.
Do you?
Yes.
Okay.
Yes. I think it's very important also. It's part of good care. It's, as long as
absolutely.
if you can have your patients trust, then they're comfortable and you're more comfortable. And I just think it leads to better care.
Yes, absolutely. Absolutely, because it's all in the connection and
Yeah,
that
for
emotional
sure.
connection and the ability of being able to listen.
Yes. Yes. Yes.
That makes all the difference in the world. And so I'm telling you, I'm thrilled to have you. How did they get a hold of you, doctor?
How did they get a?
Yes.
Another interesting story. So
All
when I was
right.
when I was doing my residency, I thought that I wanted to be a vascular neurosurgeon. But only because during the early years of my residency, you can actually do a year of something else, research or any other enfolded specialty that you want to do. And I did endovascular neurosurgery for a year, and it was the first time that I started doing surgery by myself and doing things by myself, and I felt, oh, this is really cool. And then as I started training in my later years in residency, I was doing more of the spine and more brain tumors and vascular open vascular surgery, and I was like, actually, I like this more. And so before I decided that, I had a fellowship that I had signed on to do vascular surgery, to do a specialty in vascular surgery in Boston, actually, and at Harvard. And then
Wow.
after I did my later years, I was like, actually, I don't want to do vascular. I want to do brain and spinal surgery, which I love. I feel more comfortable with. And I canceled that fellowship. And then a friend of mine told me, oh, Tenet Physician Services is looking for a neurosurgeon in Miami, especially in Hialeah and Palmetto. And I was like, I sat down with them, and in my mind, I said, if it's a worthwhile position or opportunity that I think merits me canceling this fellowship and staying in Miami, then I'll do it. And it was just that. And it's perfect because it serves a population that I'm most comfortable with. Being Latino from Puerto Rico, Palmetto General Hospital it's just that. It's just people just like me with issues, and for me to be able to help them, it's an amazing opportunity.
That's wonderful. Not only that, but you've got the culture that's connected. You've got the language that's connected, and a lot of times that's what they need just to be put at ease.
Yes.
And not only that, but you listen. So that's
Yes.
even more important. I can feel that you have an emotional intelligence about yourself.
Thank you.
So, and that's yes, absolutely. That's wonderful. So, tell us a little bit about the spinal tumors that you work with. What are some of the most common things that you're dealing with on that?
Even in the spine, the most common tumors, especially that I treat, and the most common tumors overall are benign tumors, are meningiomas.
Okay.
It's just we hear more about the malignant because those are the people who go into the hospital and probably stay within the hospital system for the longest time. And so we hear about those more frequently. But the most common spinal tumors as well are benign tumors, which are also meningiomas, which are, again, what covers the spinal cord, the coverings of the spinal cord.
Oh, okay. Yeah. Now, is it a difficult surgery or...
It
Please
can be.
share. Okay.
Yes. Usually in the brain, because these meningiomas, like I said, are from the coverings of the brain, they're
Right.
usually on the surface. They're most commonly in the surface. And those are, I don't want to say simple, because brain surgery is never simple, but they're simpler than other types of tumors.
They're easy to get
Yes.
to. And
Let's say
remove,
as
correct?
compared to primary brain tumors, which are from the brain matter itself. Those are involving the brain and parts of the brain that can be very important that control language, motor. Those are very different. So in the brain, these meningiomas, because they're from the surface, they're easier to resect. In the spine, though, it's a little different because the spine is just a circular, let's say, bony tube through which the spinal cord goes through.
Right.
And the spinal cord doesn't have a lot of space. So when when there's a mass that's growing in this very little space that's compromised already, it compresses the spinal cord, and then you can get in trouble. And so the anatomy is more intricate because you have nerves coming out of the spinal cord, and the spinal cord is so dense of very important fibers that control so much that as soon as you have some compression, you can have very serious consequences, such as weakness, bowel bladder incontinence. It's just very debilitating.
Wow.
Yeah.
Wow. Well, that is very interesting. Thank you for sharing some of that. Give us also, what other things do you work on? What other types of tumors that you're familiar with?
Well, those are the most common, but also I deal with gliomas, and gliomas are malignant brain tumors. These are cancerous brain tumors, which are a mass of abnormal cells within the brain. And these are very diffuse. They're all infiltrative in the brain matter. So
it's just not like a cluster?
It's a cluster of abnormal cells.
Okay.
But these gliomas are also infiltrative. They're not just growing within the brain. They grow around and in between normal brain.
Oh, wow.
And so that's when it becomes more complicated because, like I said before, depending on the location of these tumors, it can have very serious consequences. If there's a tumor growing in the motor cortex, which is the part of the brain that controls motor function of your hands and feet, and that's very serious because that makes the tumor very complicated to resect. Because you want to treat the patient, but you also want to maintain some quality of life. You don't want to leave someone paraplegic or something.
Right.
Yeah.
Right.
So those are some other tumors. There's tumors, pituitary gland tumors, which I specialize in as well. And pituitary tumors are of the pituitary gland, and that's a gland that controls endocrine hormones that are at the base of the skull. And so those are common as well. And those are little simpler and more fun for me to resect because I resect them through the nose.
Wow.
Yeah, so those you don't have to open the skull. You go through the nose with endoscopic instruments and...
Well, I'm going to talk more about that. Don't leave. We're going to do a commercial break, and we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, and you're listening to and watching You and Your Doctor, where we're teaching you how to live a longer and healthier life. I've got Dr. Perez on. He is a neurosurgeon and quite an amazing doctor who has worked with brain tumors, with spinal tumors, and we're going to continue our discussion so we can understand some more of what he does. But before we go any further, I'd like you to tell the audience, how do they get a hold of you? What's your contact information?
Well, I work at the Palmetto Medical Plaza. That's where my office is. And the number to that is 305-823-8510. And this is located at 7100 West 68th, 71 West 20th Avenue. It's on the 5th floor, and the suite is 504.
Great.
But the most important thing is my number, 305-823-8510.
Okay, super. And in case you missed that, you can always give All County Healthcare a call. The telephone number there is 888-717-7170. Ask for Maddie, and she can put you in contact with Dr. Perez. So
Sure.
let's talk a little bit more about the tumors and how they develop, prevention, treatment, that type of thing.
Okay. So, like I had mentioned before, brain tumors are a class of two types. There's two types of the most broad categories: non-cancerous and cancerous. And then there's tumors that are of the brain and tumors that metastasize to the brain, travel to the brain. Actually, the most common brain tumors are from other sources, from other parts of the body that go to the brain.
Really?
Yes, and this, like I said, through your bloodstream, travel to your brain, and they start growing in your brain, within the coverings of the brain or within the brain matter. And then there's primary brain tumors, such as the one that I mentioned before, the gliomas, that are from the actual brain cells. Then it's an abnormal growth of brain cells. And how do we diagnose this? That's the next question.
Yeah, absolutely. Who's at risk?
Who's at risk?
Yeah.
Everyone's at risk. Everyone's at risk. There's no algorithm to who can have it, who will not. There's definitely some genetic conditions or syndromes that include brain tumors, such as neurofibromatosis and von Hippel-Lindau, which are syndromes that make you more prone, because of genetic mutations, make you more prone to developing a brain tumor. But overall, everyone's at risk. We know that older people are more prone to develop brain tumors, but that's not necessarily to say that only old people have it. We know that children do have brain tumors, brain tumors.
Yes.
Another thing is radiation, but very specific types of radiation, not from talking on your cell phone or
that's a big controversy.
Yes. I know that's a common myth, but it's never been proven. There's never been studies that prove.
How about
a direct
X-rays, dental
relationship.
X-rays?
It hasn't been clearly elucidated. I don't think so.
Okay.
That's my opinion.
Okay.
Yes.
So what are some of the other risk factors that we should be aware of?
Overall, I mentioned the most common ones. If you have more than one first-degree relative that had a brain tumor, then maybe you should be more aware when you have a headache. Or
if the headache lasts for days, would that be a good?
Anything that's out of the norm and occurs frequently that you think is not normal, you should always see your primary care physician about it.
Okay. Especially if there's some genetic predisposition to it as well.
Definitely. But other than that, there's no good cause. There's no good. No one can tell you this causes a brain tumor, or if you eat less of this, or if you do more of that, then you won't get a brain tumor. That's not true. That's a myth. Everyone is at risk.
Wow.
Well, these three things, like I said, age, radiation, and genetic syndromes are the only things that have shown some kind of relationship to developing a brain tumor.
That is really interesting.
Yep.
So, and at what ages are you seeing the majority of these brain tumors or spinal tumors?
The majority from 40 years and older, sorry. Yeah. But like I said, no one is exempt from it. They're just more common at that age.
Right.
And there's there's a lot of types of brain tumors, right? There's gliomas, there's medulloblastomas, there's pituitary adenomas, there's ependymomas. There's many different type of brain tumors, and each of them have their own characteristics and their own set of age brackets that they affect.
Oh.
But overall, overall is that older people tend to have more tumors than the younger.
That is that's good information.
Yeah.
So if you happen to be dealing with a headache that doesn't seem to go away, or it lasts for a day or 2 days, 3 days, please get in to see your doctor, or you can call Dr. Perez as well and have that checked out, because you don't want to allow that to continue.
Exactly.
If you do not take the first steps in making sure that you get to the doctor, this doesn't stop growing, does
Yes,
it?
yes.
It just continues to get bigger and bigger and bigger.
And when you end up at the hospital, it might be too late. It might be too late for a safe treatment of your tumor. I know that I think what I tell the people that I meet and the people that I talk to in patients is that you need to learn how to listen to your body. If something's not right, I don't care if you think you're Mr. Macho Man or you can take care of anything.
Or Wonder Woman.
Or Wonder Woman. You need to get it checked. You need to go and get checked, and at least you leave with a peace of mind that you have nothing. But if you do have something, then you caught it early, and it's easier for me to treat you, and it's easier for you to have a better outcome.
Yes. And not only that, but then the quality of life as well.
100%.
Yeah, because if you allow that, I mean, it's not going to go away. That's number one. If you notice it, it's not going to go away. And the longer that you wait, the more complications and the more damage that you can create for yourself. And then the recovery time, especially if you're talking, 40 and over, even, when you get to your 60s, 70s, 80s, in that time period, your body does not heal as fast as it could if you were younger, number one, or two, if you caught it in time, if you caught it in the early stages.
100%.
So are there any other treatments other than surgery, or
Yes,
is that?
Of course.
Oh,
of course,
please share.
There's radiation. You can do radiation treatment for these tumors, for
Okay.
most tumors. The only caveat to radiation is that you can only treat a certain size. It's up to 3 centimeters usually. When a tumor is bigger than 3 centimeters, and you can't do radiation. You can do whole brain, but that's not gonna treat you as efficiently.
Give us an idea, only because some people might not understand what 3 centimeters is. About how big is that?
About this big.
Okay, so that's easily detected.
Yes.
Correct?
But what you need to understand, this might not seem big for you, but what people need to understand is that the brain is in our skull. Our skull is a closed unit, and it only holds our brain. It's designed to hold our brain. So anything that's foreign to the brain is just going to compress the brain. It's going to be in a space that's not supposed to be. So the more it grows, the more difficult and the more dangerous it becomes.
Well, I can't thank you again, Dr. Perez, for sharing your knowledge with us, your insight, and thank you that you're out there, because I am sure that you have really been a huge proponent in allowing people to live that fuller and healthier life. So I really do appreciate you coming.
Thank you.
Thank you.
Thank you for having me.
Absolutely. Well, that ends our show tonight. We're going to be here next week, Tuesday, between the hours of 6 and 7. Please don't miss us. And if you happen to miss the show tonight, you can go on allcountyhealthcare.com and we will have the show archived. Thanks so much for sharing with us tonight. Awesome job.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its host.